And in this short video, what I want to just show you is some of the key changes that are coming into place in 2019-2020 with regards to the processes involved in the UK Foundation Eportfolio. So this PowerPoint is a summary of some of the changes that are going to occur. Not all of which are mandatory. In fact, there's only one group that is mandatory. But what we'll do is run through the new forms that are going to be optional, some updates to existing forms, some of the new processes that are mandatory, and some of the new processes that are going to be recommended by the UK Foundation Programme. So if we look first at the new forms that are coming, there is a new form that's going to be called a general meeting, which is filled in as before, as you would do for, say, a clinical supervisor's start of placement or end of placement meeting, or an educational supervisor's meeting. But this is a general meeting, and I think what this does is it meets the need for those meetings that occur that don't currently sort of sit comfortably in any particular place. And so what the trainee or the supervisor can do is, as you can see at the top of the screen, fill in the reason for the meeting, whether it's an ad hoc meeting, a prep meeting, a careers meeting, the discussion that takes place, who's filling it in, and then that can be filled in and then uploaded by the foundation trainee doctor to their portfolio. So I think it meets a need and it has a general purpose. The next new thing that's coming is what's called a leader form. That's a form that actually I think is used in many other specialities. Now, I guess this is the foundation programme trying to put themselves in line with training of specialist trainees. And again, filled in the same way as previous forms are on Horus. And what this is looking for is leadership qualities that the foundation trainee can demonstrate. So as you can see at the top, there's things that they can tick, such as leading a clinical situation, organising training, leading a meeting, representing peers. So for those trainees who've stepped up and done additional work as a leader, I guess this allows them to give themselves some credit for that, and it allows us as trainers to discuss leadership skills that maybe are sometimes not touched on with foundation trainees. So that's new, and I say that's optional. It's certainly not mandatory. The other form that again is very much optional and is being piloted this year is something called the LEARN, which is going to stand for Learning Experience and Reflection Note. As it says there, this is a completely optional form, and what it can be used as is to replace any of the current SLEs that the trainees do, whether it be a mini-KEX, a CBD or a DCT. This is going to be piloted in certain regions within the UK, not East Midlands as it happens. Will be reviewed in the end of the year and then potentially brought in 2021 to all regions. So it is very much optional, not being piloted by us, but foundation doctors at our foundation school are welcome to complete the form. And this is an example of what the form will look like. So at the top you can see there are 20 foundation programme capabilities, as you'll remember from the curriculum, that the foundation doctors have to fill in. And what this LEARN form is saying is, okay, which of these FPCs, foundation programme capabilities, are you trying to demonstrate? And what kind of experience was this learning experience? Was it to replace a mini-KEX or a CBD or a DCT? And as I say, you fill it in before what went well, what was your role in the experience, the learning experience, how does it reflect on your current capabilities, what did you learn, and what should go next. So I think it's something, again, that is optional, but may well form part of the formalised ePortfolio in 2021. So those are the new forms. As I say, they're all optional. There are some minor updates to the current forms that we're already filling in. So one small change in the clinical supervisors induction meeting, there will be this Placement Supervision Group section, or PSG section. So the Placement Supervision Group is something that has been on Horus this year, but not very widely used. And the idea of a Placement Supervision Group is when you're clinically supervising a trainee, but maybe you don't actually work alongside them that often. One of the struggles is, how do you, as a supervisor, actually make sure that this person is up to the standard required? And you know, you do it by the traditional method of asking other people. And what this doing is the PSG is trying to formalise this and say, okay, here are the people that I've asked to be included in the assessment when I'm looking at my end of placement report. Who are the additional people that I've used? So this is sort of just formalising who you're going to include in that placement supervision group. And also an additional question that's going to pop up in the clinical supervisors induction meeting relates to practical procedures, which is going to ask, are there any practical procedures you feel need extra support in this placement? And again, that's going to be very much placement specific, and we'd ask you to include that there. And at the end of placement or end of year reports, again, another small change to the clinical supervisor and educational supervisor reports, they'll be asking you to review the PDPs. So, and I think this is a welcome addition. Previously, the trainees have completed the PDP, but maybe review of that PDP by the supervisors has been a little bit lacking. So there will be a section asking you to review that PDP to see whether those objectives were met or not. There'll be an additional form for the trainee to fill in, which is a reflection form, which I've listed here. And again, this allows us to improve reflective practice, essentially. And this is a more formalised form for the trainees to reflect on than they already have. So it's no change, it's just a slight tinkering of the reflection form that the trainee can fill in. So those are the optional new forms, the slight tinkering of the existing forms. There are new processes, and this is fundamental because one of these is mandatory, and that's about how the foundation trainee demonstrates CPD, and the idea being that this will put them much more in line with specialist trainees, and they're going to need to keep a mandatory teaching log. In the past, the foundation trainees have performed their CPD by attending 70% of the face-to-face teaching, and we recognise that that's probably not the best method of recording that. So from August in 2019, we're going to look at hours rather than percentages. So each foundation doctor has got to attend a minimum of 60 hours during their 12 months of teaching, during both their foundation year 1 and foundation year 2 rotations. That 60 hours is split roughly into at least 30 hours during that 12 months must be what's called core foundation teaching, and that's going to be the face-to-face stuff that we'll always deliver. So that's the face-to-face teaching is not going, but simply how trainees record this is changing, and they record this in their teaching log in the portfolio. So that's the core, which is minimum of 30 hours. There is then what's called non-core teaching, which can make up the additional 30 hours. And this really can include anything in the way that you or I probably record our CPD. So things like departmental teaching, e-learning, courses that they attend. For every hour that they can do that, they can claim an hour towards their non-core teaching. It isn't mandatory. It does not have to be logged, and if the trainee wants to undertake 60 hours of core teaching only, then they can do so. But actually, I think they'd struggle to achieve that with the current teaching that we have in place. So the rough split is going to be 30 of core teaching and 30 of non-core teaching, and that is the minimum. So 60 hours will be the minimum that we'll be looking for at ARCP. They can use a maximum of 6 hours, i.e. 10% of e-learning, to contribute towards that 60 hours of the of the learning that they need to do, and that would go in as non-core. it's important to note that things like statutory and mandatory training, which includes things like ILS or ALS, do not contribute to that 60 hours. Okay, so they can't include that, anything mandatory. The foundation doctors are going to be responsible for logging and tracking their own teaching hours, and trusts and foundation schools are going to be responsible for managing and quality assuring the process. So this is what the teaching log form is going to look like, and very similar to the sort of thing that I fill in for my CPD. What was the teaching? When was it? They can then log it as either core or non-core, and what was the teaching setting, number of hours that you recorded, and your reflections and brief details at the bottom. And any e-learning that they've got linked in, again, they can add to their teaching log. So as long as their Horus and Eportfolio are linked together, e-learning that they do, they can add to the teaching log, whether they feel it is core or non-core training. And the teaching log is kept as a live document in the summary of evidence with a colour-coded count. So we can see that the core at the top, non-core in the middle, and then a total at the bottom. And in this person has done the minimum of core teaching, but not yet achieved the minimum for the total for the year. These logs can't be edited, but they can be deleted by the trainee, and they do not need approval. So once the trainees logged it, they do not need to be approved, unlike things like the ALS or ILS that we often approve when we're meeting our trainees. And that's the most important aspect that's changing this year. There are some updated processes to make you aware of as well. So you'll be aware of curriculum mapping, and just to sort of recap, that the current existing principles are that there are 4 sections as detailed on the right, which are split into 20 foundation professional capabilities, the FPCs, and the ePortfolio allows mapping and linking into each foundation professional capacity, the FPC. There are going to be new limits put onto this shortly. In the 2019-2020 iteration of the ePortfolio, so that each portfolio item that the person has, so whether it be a CBD or a reflection, can be mapped to only a maximum of 5 FPCs. So in the past we have seen trainees write a piece or attend something and then map it to multiple of the 20 FPCs. Now the limit is going to be 5. And each FPC can have mapped to it a maximum of 5 portfolio items. So again, in the past, we've seen trainees link lots and lots and lots and lots of items to each FPC. Now, the UK Foundation Programme is saying that they want a maximum of 5 portfolio items, with each FPC having a minimum of at least 1 portfolio item mapped to it. And that evidence can be mapped and unmapped by the trainee throughout the year. So just a slight difference on how we're going to look at the curriculum. The other slight change is going to look at these, as we mentioned at the start, the placement supervision groups, the PSGs. So the current principle is that the clinical supervisor asks senior colleagues, so whether it's your consultant colleagues, senior registrars, nurses, for feedback on the foundation doctor to inform their end of placement report, so the CS end of placement report. We are strongly recommending that is bolstered up, that placement supervision groups should be gathered for at least one of the placements for each foundation doctor during the 12-month rotation. So it's been done in a very kind of hit and miss, very ad hoc manner. Over this 12 years, it is strongly recommended, although not mandatory, that there is at least one PSG feedback completed by the clinical supervisor. Who's going to do that and how? So essentially the process will be that the named clinical supervisor for each foundation doctor in their placement nominates members of the placement supervision group and is responsible for identifying them to the foundation doctor, It'll vary, but it's going to include people doctors more senior than an F2, and hopefully including at least one consultant or GP principal if they're in general practice, senior nurses, ward pharmacists, allied health professionals, and these people will form the placement supervision group that can feed back to the clinical supervisor to allow that clinical supervisor to make a rounded judgment on the trainee at the end of their placement report. So hopefully that will highlight the changes for you, and if you've got any questions, please do not hesitate to contact myself or Dr. McCulloch or any part of the postgraduate team. Thank you.